I am Dr. Gregory Foray, Registrar Internal Medicine, working at the Connaught Referral Hospital in Freetown, Sierra Leone, West Africa. I got the opportunity to be trained as a palliative care fellow at the Krishna Visual Vidyapeth Karad under the Merck Foundation Cancer Access Program in 2022 and completed in 2023. The program organized by Krishna Visual Vidyapeth through the Cancer Access Program of Merck Foundation was so informative and was really exhausting. It covered a whole lot of both scientific as well as clinical aspects of palliative care. I had the opportunity to also get postings outside the training institution itself, where I was exposed to a lot of new programs associated with palliative care. I went to Karad, where I did some 6 weeks postings there. I had the opportunity to go out with the nurses who were giving home-based palliative care services to patients who were not only suffering from cancer, but cutting across a whole lot of diseases. Example, heart failure, neurologic disease conditions like Parkinson's disease, like stroke. So those ones actually exposed me a lot and has increased my knowledge in palliative care. Upon completing in 2023 January, going back to my home country, Sierra Leone, as a first palliative care trained fellow through the Cancer Access Program of Merck Foundation. I have been working in the palliative care team, where I serve as a subject matter specialist for my team members. Things that were very difficult for the teams to discuss, for example, discussing difficult conversations having to do with death, having to do with diagnosis, has actually improved a lot with even those who have not got the opportunity to be trained as palliative care fellows. So my training here in India has really helped me a lot, and it has impacted my team back home, because for difficult conversations we are now comfortable to discuss issues surrounding death, as well as our pain management skills has improved a lot. Before my training, I had a lot of phobia around the use of opioid, morphine to be specific, but with the exhaustive training, I think I feel very much comfortable to use most of the medications that I use for pain management, and as well transferring those skills to other team members who were not opportune to be trained as palliative care fellows. So to my patients, my training has actually impacted my patients greatly, because before this time, most patients will really prefer to come to the hospital, even when everybody knows that the patient is almost around the time of dying. So now discussing with patients, the patients really makes the decision to prefer home death, wherein they die free from pain, and where we as a team are able to be with most of those patients in their houses, and even at the time when they need us the most. So I just want to thank Merck Foundation for this opportunity given to us, and hoping that they will extend more invitation to more young professionals, so the access to palliative care and the access to cancer care can be improved in Sierra Leone and Africa as a whole. So again, I want to thank the CEO of Merck Foundation and all the executive members for the support, and hope they will increase on their support to Africa. Thank you very much.